Hello, 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 YouTube world. Welcome to For Your CNA's live question and answer session. I'm Miss Patty, your host, and we come on every Thursday at 3 to answer your questions about CNA testing or training or workplace issues or whatever CNA type questions that you have. And as you come in, if you can give me a quick wave or let me know that you're here, that way I know who's joining us this week. Super excited to have all of you. And while I'm waiting for you guys to come in, I usually give a little bit of a lecture or a presentation on something that came up this week or something that somebody asked recently. And today, I actually want to talk about a comment that I got. Hi, Crow's Nest. A comment that I got on one of my videos this week. And this was transferring a patient from bed to wheelchair. So Mary Tell Me asked or made the comment, but this is an able-bodied patient. And basically, this doesn't really represent real life. What do I do with a patient that can't stand? And so it seemed like Mary was looking for more specific information. Hi, Sunshine. Thanks for coming today. So I want to talk about this because this is one of those topics that comes up over and over and over again on the channel and on other channels as well. And this is something that a lot of people that are preparing for the state exam don't really truly understand. So I want to take just a couple minutes to explain this. Okay. So when we are creating videos for you guys to learn how to do skills, either for the test or workplace or whatever, when the content creators are creating videos, we have to pick one single scenario because every patient out there is a little bit different, right? So if you've got a patient who is an amputee and maybe has one fully functional leg and an amputation on the other side, that's going to be a totally different experience than if you're trying to transfer somebody who maybe has myasthenia gravis and has just generalized weakness below the waist. Those are two totally different cases. And then let's throw in a third one. Somebody maybe that has severe osteoporosis and the bones of their heel actually are shattered. So putting weight on the heels is going to be very painful for them and very problematic. Or let's add another situation. Maybe we're transferring somebody that has, I don't know, Parkinson's disease, and they can't really move their legs really well. Everything is very shuffly because it's hard to pick their legs up. So they kind of shuffle, just slide their feet, right? Those are totally different, same skill, transferring from bed to wheelchair, but totally different in the way that you're going to perform that action because each patient is going to have a different level of ability, a different set of tools that we're going to use to help them out. So everything is different. So when we're creating these videos, we can only pick one single scenario to present to you, right? Because otherwise, transferring out of bed and into a wheelchair, I'm going to have 400 videos on that. And which one's going to help you on the state exam? It would be very confusing for you, wouldn't it? If I had, okay, if you want to learn how to transfer from bed to wheelchair, go watch these 400 videos and one of those will work for the test. That doesn't help you. You're going to be so confused by the time that's over with that I didn't help you at all. So what we do is we create scenarios that are either based on a common situation you'll find yourself in, or in the case of my videos, based exactly on the state test scenario. So I know you guys have seen this before, those of you who have been with me. in the past. This is the testing care plan sets, and I actually got the new ones now that have the right checklist on the back. But this is the testing care plan set. So when you go to test with Prometric, this is used in Prometric states, then you're going to, if you get this skill, transfer from bed to wheelchair, you would have to perform this skill exactly the way that it says here. These are the testing care plans. So that's what I base my scenario, the situation that I'm setting up for you. This is what I base it on, is the actual testing care plan. So when Mary says, but this is an able-bodied patient, yes, because for the test, you're transferring an able-bodied patient that maybe has some generalized weakness or maybe can't take a step for whatever reason, is unable to take a step, because that's what our care plan tells us. But it doesn't mean the patient is totally and completely paralyzed or has had a stroke. Those are different situations. Those are different scenarios, and they're going to require a different approach. So when you're watching videos on any CNA channel to learn how to do the skill and you're preparing for the test, understand that that is simply one possible scenario that you might see in a clinical setting. And when you get out there in a clinical setting, every single one of those patients you're going to be caring for will require a different approach. Now, so that leaves the question, okay, well, if all I see is this one way of doing it, the way the test wants it done, and I get out there in the real world and I have a patient with, I don't know, let's take the osteoporosis patient that can't put weight on her heels because those, the area, the bone is just disintegrated. So she can't put weight on her heels. So how in the world am I supposed to transfer her? Well, we have something in place for that. It's called the care plan. So every patient's care plan, because we know that every patient you see out there is going to have a different way that things need to be done. So as the nurse, all of that information is going to be found on the care plan. So I'm going to write the instructions down, and that's what you're going to get to be able to perform transferring out of bed and into a wheelchair for the osteoporosis patient, and a different care plan for transferring the patient with myasthenia gravis, and a different care plan for transferring a patient who's recovering from a stroke, and a different care plan for the Parkinson's patient. Everyone is going to have very specific instructions that tell you how to do that skill for that patient. So these videos, while they seem very best case scenario, and I hear that a lot, well, that video doesn't help me because that patient can do whatever, and I want a video that shows me how to take care of a patient with a stroke. Well, that's hard to do because the patient you're taking care of that's recovering from a stroke is different than the patient down the hall that's recovering from a stroke, or the one across town that's recovering from a stroke, or one in another state that's recovering, because all of them are going to be different. So what you're really looking for here is a video that shows you how to take care of that particular patient. That's really what you want, is you want to be able to go to my channel and pull up a video. How do I take care of Mary Smith? And you want me to show you how to do that. But the good news is you already have that. You have a nurse that has decided what's best for that patient and not given you video, but they gave you written instructions on exactly what to do to accomplish that task on this patient. And that's really where that care plan is going to be so incredibly important to you, not just for the test, although it is important on the test, but it's going to be critical when you're out there working. Otherwise, you come onto YouTube and you search for videos that you're trying to find how to take care of this one patient, how to do this thing on this patient, and you're going to be so totally disappointed because there are no Mary Smith videos on YouTube that's going to tell you how to take care of that exact problem that that patient has, because they're all different. I hope that helps you guys understand that training videos are just that. They're training videos based on one very specific situation and circumstance. So for ours, it's based on testing care plans. These situations that you're going to be tested on, but other videos are going to be showing a different scenario, and that's okay. There's nothing wrong with that, because you might find a patient somewhere out there that meets that scenario. There's nothing wrong with that. So when you're doing skills in a clinical setting, you're going to have a million ways to do the same skill. What I need you to understand is that when you're going to YouTube for instructional videos for real life circumstances, you're very rarely ever going to find a video that shows you exactly what to do with that specific patient. Okay, because they're all different. I hope that helps you guys. So let's see who's here. Hi, Blue. Warm and sunny here. Ooh, nice. It is overcast and rainy and icky here in Florida. Hi, Just. Good day. Hi, Jennifer. And three Eugene. I know you passed your exam Tuesday. You came by and let me know. You're actually on my list to congratulate in just a little bit. So we're super proud of you. Crow's Nest says, when we take the test, is it going to be on a dummy or an actual human, or does it just depend? Oh, that's a great question, Crow's Nest. So let me show you something. For those of you who have my book, if you don't have my book, that's okay. But for those of you who have my book, let me show you how this works. So let me just get to my page here. So here, this is change position to supported side lying. This is one of the pages in my book. It happens to be page 98. But at the bottom of the page down here, you actually see some information regarding the test. So you can see how long somebody with your level of experience should take to do that skill. You can see who that skill is going to be done on. So this particular skill, we're actually going to be doing it on another testing candidate. But not all skills are going to be able to be done on another testing candidate. There are some skills that are just a little too personal. So things like dressing a resident, that's going to be done on a mannequin. Partial bed bath, because you have to be undressed, that's going to be done on a mannequin. Pericare and catheter care, those are going to be done on the mannequin. And emptying the drainage bag will be a mannequin skill as well. So those skills will be done on a mannequin. All the others are going to be done on a live human, another testing candidate. So some skills will be done on the mannequin, but not very many. Most will be done on a actual human. Real quick though, when we're talking about the mannequin, so there are 5 skills that are done on the mannequin, but you want to treat that mannequin just like it's a real person. So you're going to tell them every step of the way what you're doing. I'm going to put this blanket over you. I'm going to pull your sheet down. I'm going to clean you now top to bottom. Whatever it is that you're doing, you want to talk the steps out so that patient knows exactly what you're doing. Even though they're a mannequin, you still want to talk the skill out. You also want to be very gentle with the mannequin, because if you're rough with the mannequin, the evaluator will think that you're going to be rough with a live human as well. So you treat that mannequin just like it's a real person. You want to ask questions to the mannequin. Are you comfortable? Is the water temperature good? That type of thing. The evaluator will play the voice of the mannequin, so you will get a response. Let's see here. Tanya says, hi, Miss Patty. I passed my written CNA exam. I just need to take the skills test. Congratulations. Great job passing, and good luck on the skills. Make sure you head over and to our website and watch both our animated videos and the skills videos. They're both going to be vitally important for you. Hi, Bob. Anthea says, can I do the course online? Yes, Anthea, we do have an online course. It's on courses with an S .foryourcna.com. Here, let me type it in for you. So COURSES .foryourcna.com. Okay, so that's our website for the course. And the course is open to anybody. Anybody can take it. It has my classroom lectures. It has skills videos. It has theory lessons. It has great activities like flashcards, and you have to decide what you're going to report to the nurse. You've got to put the skills steps in order. You have to choose the right supplies. So it's great interactivity to it. It'll make sure you know what you need to do. It also has my classroom lectures. So you're actually getting to see me and what I say in my classroom. But let me give you a big disclaimer here. The online program is good to get you ready for the test, but in any other state than Florida, it is not going to make you eligible to test. So if you take the course, the online course, you're not going to be able to take your state exam without going through an approved approved training program in your state. But you can use it as additional study to make sure you're ready for that state exam. So if you took a class, say you live in Georgia and you took a class in Georgia, but you're a little nervous about the test, you can take the online program to make sure that you have the skills necessary to pass, and then go take the test, and you're much more likely to pass. Most instructors are great CNA instructors. They're fantastic at their job, but they may not really truly understand the test. And that's where I come in. I get you, I'm that step in between that gets you ready for the test. So the program is available to anybody in the country. You just want to make sure that you understand it won't make you eligible to test by itself. Okay. I hope that helps. Manachika, I hope I'm saying that right. Oh, I'm sorry. Let me go to Kimberly. Kimberly says, on test day, do you receive your skills when you walk into the clinical area? Anytime given after you receive your skills? Oh, that's a great question, Kimberly. Now, if you go to my website, foryourcna.com, just the number 4, YOUR, CNA.com. If you go to my website, and in training, I've got tabs at the top. Hit the training tab. Look at animated videos. If you go to the animated lessons, toward the bottom of the page are testing concept videos. And what to expect on the CNA state exam is one of those videos. You need to go watch that because it's going to tell you all of these things. But when you go into the testing center, when it's time for your skills test, you're partnered up with another testing candidate. We just talked about that. So the two of you are taken into the testing room, and the evaluator is going to pick one of you to go first, whichever one they decide. And they are going to give you a testing care plan set, but they don't just hand it to you. They actually read it to you first. So they're going to read this to you, and then they're going to hand it to you. And this is yours throughout the test. You can look at this anytime you want to. Now, the time hasn't started yet. Okay, the clock is not running yet. So they read this to you, they hand it to you, you read it. You've got some time to think about this. And then when you are ready, you will say, I'm ready to begin. That's when the clock will actually start. Okay, that's when your timing starts. I hope that helps. So Manachika says, I would like to get ready for the CNA test. How can I contact you to get ready? Well, come to our live sessions like this. I give a lot of information. I have a ton of information on my website, but the best thing to do, honestly, is to enroll in our online test prep course because it's going to walk you through absolutely everything. And sneak peek, don't tell anybody, keep this quiet. But starting sometime this fall, something that I'm working on that I'm super excited about is I'm going to be live streaming my classroom directly into that program when I'm actively teaching. So I still teach in the classroom on Mondays and Wednesdays from 9 to 1. So when I'm teaching, that's going to be live streamed right into that online program. So it's just like you are sitting in my classroom with me and you're able to ask questions and be involved. So it's just like you're in the classroom. So that's going to be a really cool feature of the online program starting this fall. I just ordered a ton of equipment. microphones and studio lights and a big professional video camera. And I've got cameras above the bed so I can switch the camera views. I mean, it's like a really professional studio setup. I'm super excited, scared to death to learn it all. But I think it's going to be a really good addition. And I'm just like a kid in a candy store with it. It's just so cool. And I can't wait to get that up and running. But sometime this fall, we'll have that working for our classrooms so that those that are in the online program, they can actually join my live class as well. So, so let's see here. Menachika says, I see a lot of testimony. Want to be one for the future. Well, we'd love to have you. Hi, Eliana. Sunshine says, performing stoma care for a patient. Oh, that's right. You were talking about that. I forgot to talk about that. Okay, we'll get to that. For performing stoma care for a patient, is a nurse required to train the staff before the skill can be performed if the patient's in an assisted living facility? Yes, 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 yes. So let me explain this, Sunshine. And I'm actually writing an ebook on this. This is really cool too. So I got a lot of projects going on. So I'm writing an ebook, and the ebook is test coaching for the CNA state exam. I'm trying to get you ready for the test. And I just wrote this lesson 2 days ago. So when it comes to the test, there are 5 things you need to know. We've gone over this over and over and over and over in these live sessions, but remember, the written test is all about knowing your role, knowing your normals, patient rights, safety, and infection control. We've talked about that. But there's also 2 to do. Now, the 2 to do is kind of outside of that. And this really is our scope of practice. So as a CNA, we do routine tasks on stable patients according to the care plan. That's kind of what we do. That's our role. But in order to do that, we have to have been trained in those tasks. And of course, we're going to report everything to the nurse. So the 2 to do is make sure you're trained to do that task and make sure you're reporting everything to the nurse. So that kind of tells you how to do these other 5 things, right? So making sure you're trained. Well, we were trained on a lot of things in our CNA program for sure. I mean, there's a ton of information that we're covering, but stoma care isn't probably one of them. You may have read a little bit about it in a book, but you weren't trained on it because, just like I talked in the very beginning of today's session, every patient is different. So when we're taking care of a stoma, for those of you who don't know what a stoma is, sometimes when the intestines aren't working right, we actually cut a hole in the tummy and we empty the intestines out through that hole. So it's somewhere on the abdomen, somewhere on the tummy. So all bowel movements then go into a bag that's attached to the tummy hole. And that's called a stoma. So emptying that bag, cleaning it, cleaning the area around the stoma, all of that needs to be trained on an individual basis. You're not allowed to do anything you haven't been trained to do. Now, training does not have to be in a classroom. It doesn't have to be a formal thing. Training can be something as simple as the nurse takes you to the bedside, shows you what to do, tells you what to look for and what they want you to report. They watch you do it once, and now you're trained. Okay. Go by your facility policy and procedure for what they require for training. But training in a lot of cases is not going to be a formal thing. It's just going to be between you and the nurse or whoever it is that's responsible for training you in that particular task. So as long as you've been trained to do it, yes, you can take care of stomas. Absolutely. And take care of ostomy bags and things like that. But if you haven't been trained, don't do it, because there's a lot of ways that this can go very wrong. So make sure that you have that training. But it doesn't matter what setting you're in, whether it's home care or assisted living or a nursing home or a rehab or the hospital or mental health or wherever. Just make sure that you've received training for it. Okay, so let me tell you 2 stories real quick that Blue actually sent to me via email about why training is important with your scope of practice. Okay, so I'm going to kind of condense these down Make a very long story a little bit shorter. But there was a CNA, and I'm not going to use names, but there was a CNA who was assigned to care for a patient in a home care setting and had not received training on this patient. Remember, I said training is individualized, right? So hadn't received training on this patient who had a trach. Now, two other CNAs that were HCAs, home care aides, that were assigned to that patient had received training, but they weren't available that day. So this HCA, health home care aide, is now in the home with the patient, and the patient is starting to get a lot of mucus in their trach, and they're very uncomfortable, and they need to be suctioned. Now, remember, this CNA did not have training on this patient, but she had training on another patient. The patient's starting to fill up, a lot of mucus in the trach. The CNA or the HCA doesn't really know what to do here. She knows how to do the task, but hasn't been trained on this patient. She calls the office, and unfortunately, nobody's there to help her. There's nobody in the family. Patient doesn't want 911 called, but the patient's getting uncomfortable. What does she do? So because she knew how to do the skills, she went ahead and did it on this patient, but that she wasn't trained for. So it's really important to understand that training on these specialized tasks has to be per patient, not just a global general training. So unfortunately, there were consequences. Now, another situation where you could find yourself is, let's say a patient grabs something hot, gets a burn on their hand. Again, doesn't want to go to the ER because it's going to take too long. They got family coming in later, but they got this burn and it looks like a pretty bad burn. Now, the CNA, even though they may know how to do wound care, it's not ordered for this particular patient. It's not on the care plan. This is an emergency situation. So we have to get help beyond ourselves, because this isn't something that we have the training, experience, or knowledge to deal with. So this home care aide managed to convince the patient to go to a walk-in clinic instead to get the treatment they needed. They were still back before the family came, crisis averted, everything was fine, and that was within the scope of practice. Okay, but if that home care aide had just grabbed some bandage and some ointment and took care of the burn because they knew how to do that with other patients, that is not in the scope of practice. So you've got to be careful. It's really easy to step over those boundaries and to act, especially in crisis situations. But we have to remember our own limitations here, because when we start stepping out beyond those limitations, that's when we become liable for our own actions. And that's not a place you want to be, is liable. Because what if something happens to that patient while you're performing that task that you have not been trained to perform? So that becomes a very big situation. So we want to be careful about understanding what we are allowed to do and what we're not allowed to do. So operating within our scope of practice. Okay, so let's see who else is here. Hi, Gloria. Hi, Natalie. Natalie says, I'm here to testify that I passed my CNA skills last week in Seattle, Washington. I'm super excited that I'm going to be a CNA soon. I'm waiting for my written exam. Oh, congratulations, Natalie. Great job. I'm super excited for you. That is awesome. Awesome. Girl in town. Oh, I like that. Girl in town. Hi. Hi, Kimberly. Crow's Nest says, to be honest, I'm more worried about the written exam than the skills. Don't be worried about the written as long as you understand those 5 things. Now, the ebook that I'm writing, I actually go in depth. I mean, I do a deep dive on multiple questions and dissect them for you to show you what they're actually asking, help you identify the important parts of the actual question. And we look at every single answer and identify the parts of it that could potentially trip you up. Unfortunately, it probably won't be ready for your testing, but kind of keep it in mind. I will have that available shortly. But when it comes to the written test, there's 5 things they're going to grade you on. We've talked about this. Know your role. Remember that CNAs do routine tasks on stable patients according to the care plan. Make sure you're trained to do whatever tasks you're doing. Know your normals. Now, normals go beyond vital signs. It's normals for aging, normals for life stages, normals for disease process, patient rights, infection control, and safety, both yours and the patient's. So that's what they're going to cover on the written test. It's all scenario based. Go over to my website, foryourcna.com. I have a practice test under the training tab, and it'll help you identify whether you're ready for that test. But the written test is not hard as long as you understand those things. Let's see here. Anthea says, so how am I going to do the skills if I do the online course? Well, Anthea, you're going to practice on your own at home, but the written or the online course is presented in such a way that you'll learn the skills. Trust me. The way that I break the information down, so you're going to have some theory lessons first, and then you're going to have an introduction lesson that tells you why I'm doing all the steps that I'm doing, why they're important. Then you have the skills lesson where I show you the skills. And then you've got some things that you have to do. You're going to pick the right supplies. You're going to put all the steps in order. You're going to answer the questions that are presented on the screen. And then if you take the skills book, this book, take this book, when you're doing the skill at home, you just follow along. All of these steps tell you exactly how to do that particular skill. So can you learn a skills-based program online? Absolutely. The way we've laid it out for you, it's super easy. It's super easy. And this course is being used by schools and hospitals and nursing homes and colleges all over the country. It is effective. Absolutely. There's like 11 lessons that are unlocked that you can try for free. Go take a look at them. Let's see here. Tanya, hola. Yardley says hi. Hi, Hildy. Always a pleasure to have you as part of our sessions. Joao says, please, can you answer if it's okay that during closing, I wash my hands before opening the curtain and finish? Okay, that's a very good question. And I'm going to answer it in a couple of ways. That curtain is not considered clean. Remember, anybody can touch that curtain, and healthcare workers often touch the curtain with soiled hands. The patient touches the curtain with soiled hands. So that curtain is not considered clean. So if you go to the sink and you wash your hands, right? Wash your hands, and then you go open the curtain. Well, you've actively recontaminated your hands just by the simple act of opening the curtain. Now, on the checkoff thing, you guys have seen this. This is the testing care plan set. On the back are all of the checkpoints for the state exam. Well, if you look down here under, hold on, I'm trying to find it here. Yeah, one of the very last checkpoints here is, I gotta find it. Oh, it says to leave the skill with clean hands. That is the very last checkpoint. Okay. Does the candidate end the skill with clean hands? Well, if you wash your hands and then you go open the curtain, you're not ending your skill with clean hands. So that's a super important aspect of infection control that they're going to grade you on. So it may not be enough to fail you, but if you make another infection control mistake along the way, those together might be enough to fail you. So it's always a good idea. The very last thing you do before you say my skill is done is wash your hands. Let's see here. I'm just looking to see here. Ariel said, hi, Jocelyn. Ariel says, I just passed my exam. Congratulations to you. Sunshine says, having issues with nurse training the staff, what to do with training for the stoma. Oh, that's bad. You need to bring that up to your administrator because that violates your scope of practice. Make sure somebody's aware of that. Yes, absolutely, Blue. Just because you've been trained to do a stoma on one person doesn't mean you have a free pass to do it on another. Absolutely. Training has to be patient specific. And Helen asks, how can I have those 60 written questions that your book to learn how questions are being set? I actually have a practice test on my website. Go to foryourcna.com, look under training, and there's practice test on there. Go take that. But I do have a 60 question uh, practice test in my book as well. But I believe, Helen, I think you're in France, if I'm not mistaken. So I don't ship international at this time. I'm very sorry. So just take the practice test on the website. Okay. Uh, yes, Kanisha, I can say the 5 things again for the written. You ready? Everybody ready? And you can watch the replay of this. I know I talk fast. You can watch the replay of this. But the first is know your role. The second one is know your normals. The third is patient rights. Fourth is safety, both yours and the patient's. And number 5 is infection control. So those are the 5 big things that they're going to be testing you on. Crow's Nest says, I take my test next month. I have a whole month to practice the skills. Make sure you're practicing. You'll do great. And Blue says, remember with the skills exam, if you forget to do a step before you say I'm done, yeah, you can make corrections. I have a whole video of that on those animated lessons on my website. So foryourcna.com, under training, animated lessons, and I have a whole video on making corrections. And yes, you can make corrections on the state exam, but make them when you realize that you've made a mistake. Make the correction then. Don't wait until the very end of the skill to make the correction, because you may forget. So when you, let's say that you're knee deep in the skill and you look up and you realize you did not close the privacy curtain for privacy, you can say right then, correction. I would have made sure the privacy curtain was closed before I began the skill. Make the corrections when you realize it. And they're probably going to have you perform that, whatever that checkpoint is. You may have to do it. So you want to make sure that you make the correction as soon as you realize that you need to. Okay. Sunshine says, know your role, know normals, infection control, safety, and patient rights. Good job, Sunshine. All right. Great job, guys. I hope this helped you kind of understand a little bit more about how the test and the clinical life, while they're very, very similar, there are going to be differences as well. Because remember, the test is very static, one specific scenario, where clinical life is not. You've got a million scenarios just for one condition, because every patient's going to be a little bit different. So that there's no way for the test to approximate that. Otherwise, they would be having you do a partial bed bath on 14 different scenarios, and that's just not feasible for testing. So they have one scenario. That's what you're going to do, but understand that that's not the only way a skill is going to be done in a clinical setting. We're going to change it based on the needs of the patient, and that information will be in the care plan. And if you haven't been trained on something, make sure that you get that training, because if you're not trained on something and you do it, that is now your liability. Okay. And we want to make sure that you're well within your scope of practice. Crow's Nest says, yes, ma'am. Another temporary aide and I are going to practice on a senior, and a senior CNA is going to help us. Awesome. Great plan. I always recommend for my students, I always recommend to practice in groups of 3. One person is the CNA doing the skill. One person is the patient. That makes sense. The third person in the scenario should be what we call the moderator or the prompter. And you should have the skills book in front of you, and you should be reading each one of these checkpoints to make sure that the CNA is performing it properly. And if the CNA gets stuck, you tell them what step is next. So it really helps make sure that you're practicing properly, because here's the problem. if you're out there practicing for the test and you really don't know what you're doing, if you don't have instructions in front of you, if nobody's checking you, then you might get used to doing something the wrong way. And then you take that into the test and that can cause you problems. So you always want to make sure that you've got somebody there that can monitor what you're actually doing and making sure that it meets those checkpoints to make sure that you're practicing the right way, developing the right habits that you're going to take into the testing center. I hope that helps. Lena says, what can I do to memorize all the skills? Practice. Have you ever watched a movie so many times that you learned the lines? I've got a lot of movies like that I've just watched over and over, and I know what they're going to say before they say it because it's so familiar to me. Well, if you watch my videos often enough, if you just keep watching them over and over and over, you will learn what to say and what the next steps are, and it will make you more successful on the test. So don't be afraid to just put those videos on repeat and watch them to get used to it. But there really is no substitute for doing. Watching videos is great and you will learn the lines, but the problem is you got to take that knowledge and put it into practice. And that's where I really recommend that you get up and actually do the skills. So what some of my students do is they put the video on and they put earbuds in, and then as they hear me do something, they do it. So I'm right in, because if you watch my videos, you'll notice that I say out loud every step that I'm doing because I'm teaching you how to do the skill, but I still say it for the patient's benefit too. So while you're listening to me, actually do the step. That way it's guided practice and you can make sure that you're learning the right way. But having me in your ear as you're doing the skills will be very, very helpful. But please remember, you cannot have that in the test. You can't have any electronics. You can't have me in your ear. You have to know how to do this on your own. So that step in between would be the practice. You need to make sure you're practicing. Blue says, for the purpose of the test, I suggest getting in the habit of saying every step out loud. Yeah, and that does help too. But you want to make sure that you're addressing it to the patient. So we're going to tell the patient what we're doing. And you'll hear me do that in the videos is, telling the patient, okay, I'm going to put this privacy blanket over you for warmth and privacy. I'm going to pull the sheet down to the end of the bed. I'm not saying that for the evaluators. I'm saying that for the patient so that they're comfortable with the steps that I'm doing. Because remember, this is a live body and they need to know why I'm uncovering them or undressing them or moving their leg or picking up their arm. That's their body. They have the right to know what I'm doing with it. So I'm always talking out loud, telling them what I'm doing, and that gains their cooperation and their trust and makes it easier for them to work with me. Okay. Hi, Cynthia. Judith says, hi, Miss Patty. I took the test last Thursday and I passed. Oh, you failed the written by 3 points, signing up to retake it in 4 weeks. We wish you all kinds of luck and we're super, super proud of passing the skills. Good job. Let's see here. Yeah, Sunshine, it is. The videos are based on Prometric, not Pearson VUE. I know that. But the principles, the underlying principles are the same. It's the scenarios that have changed a little bit. And Judith says, thank you so much. Oh, you're very welcome. All right, guys. Well, that's going to wrap it up for this week. And so I want to congratulate, this is my favorite part. I want to congratulate the people that stopped by to let me know that they passed the CNA state exam. So Anna Martinez passed 2 days ago. So a baby CNA, congratulations. Esther Dixon stopped by to let us know that they passed as well. Solo Vu or View, I'm not sure. Let us know they're all the way in Hawaii. So aloha and congratulations on passing the state exam. And 3 Eugene also, who's here, stopped by to let us know that they passed as well. Marie White is testing August 3rd. So we are going to send out huge good vibes to Marie White. And if you passed, please make sure you stop by one of our videos, leave me a comment. Don't put a reply to somebody else's comment. Make sure it's a fresh comment because I see those. let us know that you passed so we can congratulate you as well. We want to welcome you into healthcare. And if you are getting ready to test, let us know so we can send out some good vibes to you as well. Lots of good luck on the test. But guys, if you remember these principles, you'll have no problems at all. Keep your eye out for the ebook that I'm putting out. I think you guys will find it very helpful. And make sure that you go to the website, those of you who are getting ready to test, and watch those animated lessons as well as the skills videos as well. I hope that helps, guys. Get You Five says, wish me luck taking my written exam on the 25th. We do. We wish you lots of luck. Good vibes to you as well. I hope you guys have a fantastic weekend. Do something fun. And I will see you next week, same time, same place. Those of you who haven't, if you hit the subscribe button and you ring that little bell, YouTube will actually let you know when I'm live. And that way you just have to click one button and you show up in here with me. And that might make it a little bit easier. So if you haven't subscribed, please think about doing that. We'd love to have you. And until next time, guys, happy caregiving. Bye.